Good evening. I'm Andrew Chen.
And I'm Adrienne Arsenault. Tonight, looking forward but with an eye on the past, Canada marks 1 year in the pandemic.
Sacrifice and solidarity.
Our frontline and essential workers deserve our thanks and praise.
Rosie is here with that issue, plus confronting new anxieties about a vaccine.
Also, the pandemic abroad.
I will not relent until we beat this virus.
From a U.S. presidential address to new worries in India.
Unfortunately, we are giving the virus a free rein.
And Prince William's response to a hard question.
Can you just let me know, is the royal family a racist family, sir?
Plus, those glaring car headlights.
They're not high beams, that's low beam.
Oh my gosh.
That's North American average headlights.
Find out why it's an easy fix. This is The National. The world turned a sharp corner 1 year ago today, then hurtled down a path we still can't see the end of.
On this anniversary of the global pandemic, battle-weary Canadians can only brace for what's next. A field hospital taking shape in Ontario to prepare for an anticipated third wave. Children torn from school and friends in a year of hard lessons and endless tests. Livelihoods deferred or worse, destroyed. And of course, the lives lost. Flags were lowered today out of respect.
The toll so far is staggering. Could we really have fathomed 1 year ago that COVID-19 would take well over 22,000 Canadian lives, or that about 2/3 of those would be in long-term care? Though there have been many more recoveries, nearly 850,000. And as of today, more than 2.7 million doses of vaccine have been administered. But still a long way to go, and perhaps even more to take stock of. Alison Northcott begins our coverage in the hard-hit province of Quebec.
Bells rang out across Quebec to honor the memory of more than 10,000 people who have died in the province from COVID-19. It's the highest death toll of any province, and at ceremonies today in Quebec City and Montreal, politicians, grieving family members, and healthcare workers gathered.
It just came very fast, and it took our people very fast. Today, I have that opportunity to say goodbye.
Nos soignants, soignantes.
Premier François Legault recognized the contributions of healthcare and essential workers and pointed to the particular toll the pandemic has taken on seniors. Quebec remembers all those people who left us much too quickly, he says. Across the country, the virus has killed more than 22,000 people and left so much grief, so many isolated.
Reach out to the young people in your life. Remember how important it is to hold them close.
Thank you, Joe. In Edmonton, gold flowers laid in memory of hundreds of Albertan seniors and calls for better care for the elderly. A long line of candles marks the loss of 640 people in Winnipeg, and in St. John's, flags were lowered to half-mast.
They truly were people that walked into the room and just made it brighter.
Ian Perez lost his parents, Frank and Doris, after an outbreak at their Montreal long-term care home.
We've not had a funeral. We were able to basically say a prayer over FaceTime over their caskets.
He says governments need to learn from the thousands of deaths in long-term care and invest in fixing long-standing problems.
When COVID came along, it was the perfect storm because they didn't have adequate health and safety protocols. They didn't have enough staffing, and I don't actually blame the healthcare workers for this. I think it's the lack of funding. They were doing the very best they could in a very broken system.
Today, he says, is important to remember his parents and all the victims while he waits for the chance to say a proper goodbye. Alison Northcott, CBC News, Montreal.
The Prime Minister has declared this a national day of observance for the loved ones taken by COVID-19 and for everything else that was lost.
It has been a tough year, a heartbreaking year, but it has been a year that we have faced together, and that is something we must never forget.
And without a doubt, this was also a year that tested the leadership of Justin Trudeau as government reached into the everyday lives of Canadians like never before. So let's get into that right now with Rosie Barton, our chief political correspondent. Rosie, what are some of the criticisms of this government? And I know there are many.
Yeah, I mean, listen, this pandemic has exposed real inequities in how we treat people in this country. Perhaps the biggest failure, and I'm sure everyone would agree with this, is the response, and it's a responsibility of all governments, frankly. It's how we care for our oldest Canadians. But there have also been very specific criticisms for the federal government, a reluctance, remember, to close the border initially before now implementing some of the toughest border measures in the world. There were serious problems at the beginning in acquiring personal protective equipment. It was a bumpy start to vaccines arriving in this country. So the analysis of how and why we were so unprepared and how we are going to prevent this from happening again will be a really important part of this conversation going forward.
Okay, so moving forward, as you say, where are the hurdles there?
I mean, the immediate one that you guys have talked so much about this week already is vaccinating the population. 8 million doses will be in this country by the end of the month. A lot of that responsibility now shifts to the provinces to execute. But really, the next big challenge for Ottawa is the economic recovery. At last look, the country was $400 billion in deficit. More than 800,000 Canadians are still looking for work. Our growth has had one of the biggest contractions since the 60s. And this government has not produced a budget in 2 years. The finance minister said today that this will happen this spring, but what the recovery looks like, how the government transitions from supporting Canadians to creating growth is a real hill to climb. Just a bit later at issue, we'll look at the government response to COVID-19 and how the opposition sees it and whether there are big political lessons here to learn.
All right, Rosie, thanks for all that.
Thanks.
Well, Canadian health officials are closely watching overseas studies of the Oxford AstraZeneca vaccine. 9 European countries have hit pause on using it. Christine Birak looks at their concerns and why Health Canada stands by the vaccine.
This side, I'm assuming everybody's here for a vaccine.
These Canadians are lining up for the Oxford AstraZeneca vaccine. While questions around who should be getting it still aren't settled, Danielle Kaplan is now worried about unconfirmed reports of blood clots.
It just makes me feel a little insecure, and I would just like this clarified.
This vaccine honestly can't catch a break.
In Denmark, use of AstraZeneca's vaccine has been put on hold following reports of severe cases of blood clots in people who'd been vaccinated. Other countries have followed suit but insist the move is precautionary.
Bad things happen to people who also happen to get vaccines. And so it doesn't mean that the vaccine caused it. And so that's what they have to investigate.
The European Medicines Agency issued a statement saying there is currently no indication that vaccination has caused these conditions, adding the vaccine can continue to be administered.
You have to view it in the context of the number of vaccinations that are ongoing and the frequency of these events in the usual population.
As of March 10th, 30 cases of blood clots were reported, including 3 deaths. That's among 5 million people vaccinated with the AstraZeneca vaccine within the European Union. Experts say the benefits of this vaccine still clearly outweigh the risks.
It's extremely unlikely that there's any kind of issue. And even if there were, the risk from coronavirus is far greater than any risk related to this kind of problem.
I think it's more important to have the vaccine than not, but I just want to feel a little bit more confident.
While there was talk of certain batches of the AstraZeneca vaccine being investigated in Europe, a company spokesperson says for the record, the doses currently being rolled out in Canada come from a completely different manufacturing plant. Christine Birak, CBC News, Toronto.
Well, new studies are suggesting just how effective 2 other COVID-19 vaccines are against the virus. Novavax says its vaccine was 96% effective in a late-stage trial conducted in the United Kingdom, reporting no cases of severe illness or death among those who got the vaccine. It was also found to be 86% effective against the variant B.1.1.7, first identified in the UK. Meanwhile, Pfizer-BioNTech says new real-world data suggests their vaccine is 94% effective in preventing asymptomatic infection, which means it could help slow silent transmission. The new data from Israel also shows the vaccine was 97% effective in preventing symptomatic disease, severe illness, and death.
Ontario health officials released new COVID-19 modeling today with a focus on the variants of concern.
We expected to have 18 months of pandemic. We still have another 4 to 5 months of clear, hard work ahead of us to keep our numbers down while we do the vaccination, while we get caught up.
And And variants of concern now make up over 40% of Ontario's daily cases. Assuming variant transmission remains low, 3 weeks from now, the province could see around 2,000 cases a day. A worst-case scenario would see up to 8,000. ICU occupancy could range from roughly 400 patients to something closer to 700, putting great strain on that part of the system. The variant first seen in the UK is now being seen in an outbreak in the northern Ontario city of Sudbury. This is so serious, the province is putting the city into lockdown. As Cameron McIntosh shows us, the situation resembles the outbreak in another northern Ontario city.
It's simple and stark math in Thunder Bay. More new COVID cases in the last couple of weeks than all pandemic. For Jack Murphy, it's not just about closing his gym again. It's kids back to homeschool. Stress, uncertainty, life disrupted.
We don't know what's going to be going on. There's no timelines that are given with any of these lockdowns.
Until now, Thunder Bay, relatively isolated, was relatively unscathed. Last month, outbreaks spread in 2 correctional facilities and within the homeless community.
It is being spread, from person to person. It appears really fairly easily as people, get together or are interacting.
In the federal health minister's riding, schools are closed along with non-essential businesses. The main hospital has had to transfer patients to other regions to keep the ICU manageable.
Speaker, Thunder Bay is in absolute crisis.
In seemingly far-off Toronto, the opposition raising it in question period, along with First Nations vaccines in the north.
What has Ontario done to...
This Indigenous MPP criticized by the Premier for traveling outside his community to get one.
So thank you for doing that and kind of jumping the line.
Turns out that MPP was invited. Politics aside, vaccines are being prioritized to the region. But that alone won't resolve this. Meanwhile, in Sudbury, cases are also starting to spike. Grey restrictions effective midnight.
We're seeing evidence of the United Kingdom variant in our community. We know that it is much more highly transmissible.
Murphy, meanwhile, is hoping health officials start considering proposals for businesses like his to operate safely. He's getting by largely on support of customers still paying fees.
We don't know how long we can sustain it.
For Ontario's north, it's also an outbreak of uncertainty. Cameron McIntosh, CBC News, Winnipeg.
U.S. President Joe Biden marked the anniversary by signing into law a nearly $2 trillion COVID relief package for a country that's been absolutely ravaged by the pandemic. When it was declared, the U.S. had just over 1,100 cases and 33 deaths. Since then, there have been at least 29 million cases and more than 530,000 deaths. Tonight, Biden addressed Americans to reflect and cast forward. Katie Simpson has more from Washington.
Good morning, ladies. We don't have Pfizer, okay?
The vaccine team calls this crunch time. In the hectic moments before the clinic opens, doses are handed out as they prepare to deliver hundreds of shots. The mood is serious, but distinctly joyful, a rare place of inspiration these days.
I am overcome with emotions and basically on the verge of tears.
Just feeling like there's finally a light at the end of the tunnel.
It's a wonderful experience. It's sort of like Christmas in March.
The ramping up of vaccine distribution is what's giving many Americans hope. 1 in every 4 adults in the U.S. has had at least one shot, and on Saturday, the U.S. reached a high point, injecting 2.9 million doses in a single day. Compare that to Canada, where roughly 2.7 million shots have been administered in total.
Good evening, my fellow Americans.
In his primetime address, the president directed states to make all adults eligible for the vaccine by May 1st, and in doing so, predicted life may start to return to normal by the 4th of July.
Where we not only mark our independence as a nation, but we begin to mark our independence from this virus.
While cases have dropped dramatically, the U.S. is still averaging 67,000 new daily infections and more than 1,400 deaths per day. There are fears of a fresh wave as some states are rolling back or dropping COVID restrictions.
I'm looking forward to taking my kids back to a playground.
Jamie Nishi works in global health policy, and yes, she's wearing a Dr. Anthony Fauci mask. She's worried people are going to start letting their guard down.
I'm not changing my behavior today or in 3-4 weeks when I get my second shot. We really have to stay vigilant.
How fast the U.S. gets vaccinated has implications for Canada. The White House has said it will only discuss sharing its supply once Americans are taken care of. Katie Simpson, CBC News, Washington.
Canada is one step closer to expanded medically assisted dying laws that would include people suffering solely from mental illness. A government motion on the issue passed this evening, but as Catherine Cullen tells us, passionate arguments remain on both sides.
Adam Meyer Clayton said his life was filled with pain. He was treated for a host of mental illnesses.
Non-existence is better than this.
He wanted the law to change so he could end his life with a doctor's help. But in 2017, he died by suicide.
These people are suffering, and if there are doctors willing to help them to end the suffering when there's no hope in sight in the foreseeable future, let them have a dignified death.
The world lost its color.
But others fear the consequences.
I'm speaking about my mental health struggles because I'm scared that doctors could soon be able to end the lives of people suffering with mental illness.
2 Conservative MPs put together this video arguing against changing the law.
I might have used it to end my suffering as soon as I could.
The new law would allow people who aren't already close to death to have a doctor's help to die. After a recommendation from the Senate last month, the government is now adding those who are suffering only from mental, not physical illness. The change would take effect in 2 years.
That would allow facilitated suicide through the medical system for people struggling with depression and other forms of mental illness.
I think it's irresponsible of any member to try to say the government is trying to facilitate suicide.
In fact, the Justice Minister says a panel of experts will recommend mental health safeguards.
We have to distinguish which cases where there's a possibility of improvement, when the symptom of perhaps wanting to die is part of the condition itself.
But the debate on the law itself was forced to a vote by the Liberals and the Bloc.
Why would the government limit reasonable questions of concern?
Canadians are expecting us to get the job done.
The issue now heads back to the Senate with the clock ticking on a court-imposed deadline 2 weeks away. Catherine Cullen, CBC News, Ottawa.
Canada's new acting chief of the defense staff spoke publicly as such for the first time today as allegations of sexual misconduct rock the top ranks of the military.
Parts of our culture are exclusionary. They are harmful. These issues are systemic. We cannot accept our own people being harmed from within.
Lieutenant General Wayne Eyre took the position just last month. Admiral Art MacDonald temporarily stepped aside while sexual misconduct allegations against him are investigated.
Prince William is denying accusations of racism leveled against the royal family, directly addressing the controversy for the first time since Meghan and Harry's explosive Oprah interview. Renee Filipponi has the details.
Engaging with the public is an ordinary occurrence for the Duke and Duchess of Cambridge. And when reporters yell controversial questions, royals usually don't respond. But this week has been anything but normal. Today, Prince William did.
Sir, have you spoken to your brother since the interview?
No, I haven't spoken yet, but I will do.
And can you just let me know, is the royal family a racist family, sir?
No, we're very much not a racist family.
A short response, but the first to come directly from a senior royal following Sunday's Oprah interview.
Personally, I think it was a good thing to do. I think people have been waiting to see something a little more forceful by way of response than the palace statement.
Earlier this week, the palace would only say allegations of racism within the family were concerning, but would be addressed privately.
When you say "and well," what did you mean?
In the bombshell interview, Meghan and Harry claimed a member of the family raised concerns about how dark their son's skin would be, and said the family didn't do enough to address the racism directed at Meghan by the press.
Yet no one from my family ever said anything over those 3 years. That hurts.
I think denial is a very bad place to begin.
This professor of post-colonial studies says she is disappointed by what she calls Prince William's simplistic response, to that direct question.
I think that the family is being asked to think about race and to think about whiteness and to think about their relationship to, empire and colonialism and the history of race in the British monarchy. I think to reduce it to we are or we are not racist, I think it's a real shame.
Early on, the couple were seen as a bright spot in the traditional monarchy and an opportunity for a more diverse future. But for now, those hopes have been shattered and the palace is in damage control. Renee Filipponi, CBC News, London.
Well, tonight, a CBC Marketplace investigation is hitting the road.
They're not high beams, that's low beam.
Oh my gosh.
Coming up, the simple fix for that headlight glare.
And an urgent challenge in India. Why in a country producing so many vaccines, so few seem to want it?
Nobody's infected here. Nobody.
And for a year now, they've helped us navigate a pandemic.
Sometimes it feels like a decade's passed.
It really did show in this pandemic how much our world is really connected.
I can't wait to see my folks and to give them a giant bear hug.
We give the doctors a moment to reflect. We're back in 2.
Welcome back. Around the globe, COVID-19 has spread so much since the World Health Organization declared a global pandemic 1 year ago today. On that day, there were 118,000 cases worldwide. Since then, the world has surpassed 118 million. More than 2.6 million people have died. One of the worst hit countries, second only to the U.S., is India, where more than 11 million have been infected. CBC's Salima Shivji looks at why some are worried cases could spike again.
A crush of people that's startling to see even in normal times. Tens of thousands descending on the Ganges River for a holy dip to wash away their sins. I feel at peace, she says, and so happy to be here. This is one of the world's largest religious gatherings under the shadow of a highly contagious virus, and it feels as though COVID doesn't exist.
Nobody is infected here. Nobody. And even if they are, once they dip in, they're all pure. Their impurity is gone. There's no COVID here.
Another dangerous gathering threatening to be a super spreader, health officials say.
Unfortunately, we are giving the virus a free rein.
The push to rein in COVID is top of mind in central Delhi. With a quick jab, 77-year-old Raj Kumar is one of the lucky few on his way to immunity. India has a surplus of vaccines made domestically, but it's not a leader in the drive to vaccinate. Less than 2% of the population has had a shot so far. Many frontline health workers skipped their appointments. Sanjeev Sood is doing his part with a quick photo blast to his friends.
Why should they be so afraid of getting it done? Everyone should get it done.
The hesitancy was bolstered by a sharp drop in India's infections and hospitalizations early this year, a mystery that some struggle to explain.
There was also the feeling that the mythical herd immunity had arrived. We have achieved that nirvana.
Not true, he says. While there may be pockets of immunity in dense cities like Delhi and Mumbai, nobody knows what level is needed to halt this virus. The worry is people just aren't worried enough, with cases again on the rise and the country today lodging its highest case count so far this year.
The lesson being India's natural advantages that make it less susceptible to the spread of the virus. Warm weather, a young population, and many people living in the countryside can only get them so far if masks and physical distancing are abandoned. Salima Shivji, CBC News, Uttarakhand State.
Well, the CBC Marketplace investigation is putting car headlights to the test.
They're not high beams, that's low beam.
Oh my gosh.
Ahead tonight, why your car may be hurting other drivers' eyes and the easy fix to make it safe.
But first, Rosie is back with that issue.
Adrian, tonight we're going to have more on the political lessons 1 year into the pandemic.
It has been a year that we have faced together.
Chantal, Andrew, and Althea will join all of us right after the break.
I know that people are worried about what they're seeing on the nightly news.
A moment and a message from this day last year, before everything changed. Today, exactly 1 year into the global pandemic, political leaders looked back on the toll of the crisis and the loss.
It has been a year that we have faced together, and that is something we must never forget.
But also looked ahead to the political lessons.
We must also recommit as Canadians to ensure that our country is never again unprepared. We must learn the lessons, build capacity.
We have to also commit to preventing this from ever happening again.
So how has the pandemic changed governing? What are the big political lessons out of this? It's Thursday. I'm here with Adishu, Chantal Hébert, Andrew Coyne, and Althea Raj, all joining us from their home studios as they have now for the past year, believe it or not. Look how good they look still a year later. I know that this is a very hard question, but let's try and answer it. About the biggest political lesson that you could take away from the past year and what that might be for the government. Chantal, do you want to start us off?
Oh, thank you for that. I'm guessing for all governments that the typical Canadian way, the middle of the road, is not a safe place in a crisis. That you need to pick a lane, and the longer you take, the more likely you are to get hit, be it border closings or lockdowns. The default tendency in Canada of all governments is to seek the middle of the road. In this pandemic, that was an unsafe place to be for governments, but also for Canadians in general.
That's a pretty good answer there. Andrew, how about you?
I suppose it's that it's good to be in government in a situation like this. There is a tendency for people to rally around in a crisis, the benefit of the doubt, in other words. And you've seen this in some of the polling data that, or elections for that matter, that were called that people thought were great risks and that it turned out to be quite successful for the incumbents. It doesn't seem to have a lot to do with your actual performance in the job. Look at, for example, François Legault in Quebec with objectively the worst results in terms of deaths, in terms of cases. But it does seem to have a lot to do with your presence, with the degree to which you show that you're empathetic, the degree to which you show that you're calm and in control. And being in government, you have control of much more of the communications machinery than anybody in opposition. So all in all, if you had to choose whether to be in government or in opposition, obviously there's many more serious issues still within a crisis than that. But just in terms of the politics, I think you can see the advantages to the incumbent. Okay, that's also a good one. Althea, your thoughts?
Well, I would say on that, I think that everybody would pick being in government, no matter, this is better than the worst days being in opposition. But I would say the big lesson for the Liberal government has been that it can spend as much money as it wants, basically consequence-free. I think to Chantal's point that, better go big than sit on the sidelines has been a lesson that everybody has learned. But I think people who receive checks and even people who did not receive checks are happy that the government is caring for their neighbors. But that fiscal promise that the Liberals trumpeted in 2015, bringing in Paul Martin, suggesting that there was going to be some kind of middle of the way road, is really completely out of the window. And there is no consequence for the government. And frankly, there is no consequence for the opposition either, to be encouraging the government to spend less or to be more cautious in its approach. Yeah, there doesn't seem to be a lot of room for the Conservatives at any rate to say any of that. Chantal, you want in, yeah?
Yes, but we're saying this with our eye on a rear view mirror that doesn't look back very far, or that doesn't look forward very far. So yes, at this point, there is no price to pay. But I would also look on the bright side that Canada, despite serious political differences between a number of provincial governments and the current federal government, did manage to keep those differences under wrap for the better part of a year, to look together in the same direction. And I think that's something we should, looking back, be thankful for. That the last thing that Canadians needed was for governments to take out their differences in public. And they did, and it's a credit to the premiers and the Prime Minister that they did manage to do exactly that.
it didn't last, obviously. Go ahead, Andrew. Yeah.
Well, and also that to the extent to which people in politics have disagreed, and disagreement is perfectly healthy and natural and normal in a crisis, particularly something as serious as this, when the question is how to deal with it. But there hasn't been disagreement that it is, in fact, a crisis. There hasn't been the kind of denialism that you've seen in the United States in particular, where people claiming we don't need to wear masks or we don't need to do this or that. It's been much more, what's the best way of addressing it? Have you done this? Have you done that?
And that has helped everyone, Althea, would you say? That sort of collaborative approach?
Well, it has not helped the opposition, who has struggled to really gain any traction. I think the lesson, like financial, health-wise, everything has been that you will not get criticized for not doing enough. And the criticism that you may get for doing too much is definitely worth the price. Okay, so let me push you all a little bit forward then, because the next part of this is really about what happens to our economy, the recovery, how do we make sure that people get back to work or into the workforce? And so how important is that piece of it, Chantal, to what Andrew's speaking of it, whether it be the budget or the things that follow?
I may be a contrarian, but I do not see the upcoming budget as the budget, capital B, that will determine the way forward. And the reason I'm saying that is we have a minority government. This budget is going to be written with an election in mind. And before all of the consequences have kind of been measured, it doesn't really matter that the budget is this week or in a month. We will still not have a clear picture of the field of ruins that is left behind after the pandemic. So that day of reckoning, yes, it will come, but this is something that will be coming for just about the entire world and the world economy. I don't think we're going to be able to cast judgment on how hard it's going to be or how easy within the next 3 to 6 months or even in the next election. I'll just remind you that while all this was happening, climate change, major challenge, fiscally and in all kinds of ways, has not gone away.
But surely, Althea, they will have to signal some things in that budget, right? Whether it's because it is the thing that they will start to rebuild on, or it's because it's the document that they will campaign on.
Well, I guess it all determines on when that budget is actually presented. And they've been very cagey on that. So no, but it will be very different. If they present a budget in April, or if they present a budget in June, or if they present a budget in September, you're facing different parts of the crisis, and you're also signaling whether or not it is primary. I mean, they're always political documents, but whether it is an electoral document or not. And I think that's going to be the primary determinant about what it actually is in the budget. I don't think, I agree with Shahzad, I don't think we're going to see a pathway for a post-recovery. I think we're going to see big ideas, but those are the same ideas they basically presented last September in their throne speech. And, to the opposition's point, and they have been saying this for a long time now, 2 years without a budget is a very long time. And if the Ford government can chew gum and walk at the same time, the Liberal government deserves to be criticized for not introducing a budget as well. At the very least, if they intend to drag this out for several months, they should present some sort of fiscal update that gives the country a sense of where things are at financially.
Andrew?
I think there's going to be one very critical question up for grabs in the next budget, and that is, have we essentially abolished scarcity? That is to say, can governments borrow essentially without limit because interest rates are so low that the costs are trivial? And so therefore we can borrow not only to fight the pandemic and its aftermath, but we can borrow to finance a lot of new social programs that we'd prefer not to pay for with taxes. That's a tenable proposition in the short term. Interest rates are low, but at some point, presumably, they're going to go back up. And then I think we're going to be into a series of very interesting budgets. We're going to be condemned to live in interesting times, as the saying has it, because the costs of interest are going to go up, and therefore questions about whether to raise taxes are going to come up. Questions are going to be raised about whether or not we in fact can afford to have sort of our cake and eat it too, or whether we have to make some choices. So I agree with Chantal. I think this will be the first of many interesting budgets. 30
seconds, Chantal. Yep.
Whether it's now or in September, it will always be an election budget. But what Andrew is talking about will happen, and at that point, it may be less fun to be the government.
Yeah. Indeed. Okay. Thank you all. That was a really good conversation. I appreciate it. If you want to subscribe to At Issue, the podcast, because that also exists. We've got some extra content there, including the panel's take on this story.
I won't comment on what's going on over in the UK, but I will continue to endeavour to fight against racism and intolerance every single day in Canada.
You can find that on any major podcast app and our website, cbcnews.ca/thenational.
All right, there's my friend. Lots to talk about. What are you working on for this Sunday, Rosie?
Well, I can give it all to you because I've already done it in this case. The former governor of the Bank of Canada and the Bank of England, and now United Nations climate advisor Mark Carney, the Canadian, of course, has written a new book about climate change, but also about COVID and some of the things that need to change in the wake of these two crises. So I had a long conversation with him, and I'll bring you some of that. Actually, I'll bring some of it to you on the National tomorrow, but the full conversation on Sunday.
All right, on Rosemary Barton Live. Thanks, Rosie.
Thanks.
And next, are your headlights glaring to others on the road?
We're going to measure the illuminance.
A Marketplace investigation reveals a pretty common car problem with a simple fix. Plus,
I can't wait to see my folks and to give them a giant bear hug.
The doctors reflect on a year of COVID-19 and the moments they are most looking forward to.
Hey, welcome back. So here's something drivers at night can relate to. On an otherwise dark road, you're suddenly blinded by the lights of an approaching car. Now, some believe things are getting worse because car headlights are getting brighter. So to find out, Charles Iagro and the CBC Marketplace team looked straight into it.
They're not high beams, that's low beam.
Oh my gosh.
That's North American average headlights.
Bruce Haycock studies headlight glare. We're at his underground lab at the Kite Institute in Toronto. The car we're driving is on a moving platform, and all this isn't real, but it sure feels like it is. This feels like just like driving on a country road in Canada. Haycock says I'm like many Canadians who wince when faced with bright lights on the road. It's so distracting. Though it may seem like headlights on the road today are brighter than before, this scientist says many are actually out of alignment.
The headlight beam has a pattern where it's brighter in some areas and dimmer in others. You want that bright pattern to be on the road and not on the other drivers.
So we put that to the test, measuring how bright those lights really are.
So we're going to measure the illuminance.
And test the alignment of two cars offset, as if driving toward each other. Russ Murdoch uses an optical aimer to assess it.
We can see on the screen inside the box where the beam pattern is, and we adjust to the grid lines that are on the aiming screen.
Turns out the headlights on our Marketplace test car are misaligned. Why does that matter?
Well, it matters because glare coming off of misaligned headlights, it's even worse when the weather conditions are bad. Being on the road, you can't see what lane you're in. Some people have ended up in the ditch.
The U.S.-based Insurance Institute for Highway Safety says around 50% of the headlights they've tested are misaligned, even when they come right off the production line. Wear and tear can cause headlights to shift too. The good news?
On this particular vehicle, all we need is one Phillips screwdriver.
On our test car, it's a quick fix, but the challenge, most drivers don't know their headlights are a problem because they only shine in someone else's eyes. It's why experts suggest getting your headlights checked as part of regular maintenance. Charles Iagro, CBC News, Toronto.
And hey, you can tune in tomorrow night for more on this story on CBC's Marketplace. The full investigation airs at 8 o'clock p.m., 8:30 in Newfoundland and Labrador.
When we come back, finding inspiration inside the box.
The thing about Zoom is that you just can't get a good camera shot. I've got to paint them the way they are.
Staying connected during COVID, painting quintessential pandemic portraits.
First, though, we're planning something for tomorrow night. Do you have an essential worker that you want to thank? Well, record a short video and send it our way at thenational@cbc.ca, or you can message us on Instagram at CBC The National.
Welcome back. Zoom calls with friends just might be the ultimate pandemic experience, a way of staying connected during lockdowns, but at the same time, a symbol of our isolation. And for an Ontario artist, all the Zoom chaos has become a source of inspiration. Here's David Common with her story.
Just a few steps from home, Rosanna Dewey has her serenity. In the wake of the pandemic, the heavy headlines, the non-stop bad, painting is her escape.
It's so intense, and here I feel safe, and I can work away, and it doesn't feel so close.
But in an age of lockdowns, finding subjects in person is problematic. Her local gallery, though, set up a challenge: show connections during COVID. And that sparked an idea for Rosanna.
I thought, I don't know, what connections do I have? And I realized my connections are my friends on Zoom. And so I started painting them. They didn't know about it. I didn't tell them. I just painted them when we got together.
There, now I hear you.
How are you doing?
These friends are artists themselves, part of an online class established during the pandemic. One part social,
Show your work to your camera. 3, 2, 1.
one part art.
Nice.
Well, the Zoom classes have saved myself from COVID insanity.
And some people wondered what quiet Rosanna was doing.
Rosanna, I was getting used to looking at the top of your head quite often, and I knew you were doing something sneaky on the side.
Little did they know, while they talked, she secretly painted.
I had great models,
After many classes, the portraits started to come together.
I wanted to catch them in very naturally, because the thing about Zoom is that you just can't get a good camera shot. There's bad angles, bad lighting. If you have the laptop camera too low, you get all these chins. And if it's too
or
hot,
nostrils.
Yeah. And it was like, no, I've got to paint them the way they are.
Only when they were done did Rosanna reveal why she'd seemed so distracted in the Zoom class.
When Rosanna showed her initial portraiture, I thought that was a brilliant idea. I was almost jealous that I didn't come up with that.
It felt very special and a little mirror into something that we didn't expect.
It was lovely to see the result at the end, Rosanna. It was really amazing.
Your portrait was great. I loved your pose. I thought it was perfect.
And that gallery, which challenged her to show connections, it'll hang her art just as soon as that can happen.
It's my visual diary of the experience. It's maybe not the nicest part of our history, but
it's still part of it.
It's still part of it. And it needs to be, and it has its own story.
That story, that experience, that lifeline is art. But at its heart, it's about what so many of us miss: being with friends. David Common, CBC News, Haliburton, Ontario.
Okay, note to self, sit up a little straighter on my next Zoom call. Okay, next on The National, our healthcare workers have been our heroes for a year, and tonight we're going to hear their reflections in our moment. Next. Well, frontline workers have been our heroes this year, and many nights here on The National, we've had a few of them on the program. Doctors helping us understand the pandemic one step, often one question at a time. So tonight, we want to turn the moment over to them to hear their reflections from this past year.
I'd have to say that most of it has actually been quite positive, and that people have sometimes really reached out to say, thank you, the information you shared made me feel less anxious. And so that's been kind of rewarding, honestly.
It really did show in this pandemic how much our world is really connected.
I do remember seeing an email notification about a mysterious pneumonia in Wuhan on December 31st. And I thought, oh dear, I wonder if that's going to be a thing.
Sometimes it feels like a decade's passed since things were kind of what we used to think of as normal.
Everyone talks about COVID time being 3 weeks for every day in that sense, right?
I just can't wait to see vaccine roll out and to be able to see my parents and my family again.
I can't wait to see my folks and to give them a giant bear hug.
Going to the Raptors. I mean, I'm a huge Raptors fan, and it seems crazy to go to a game with 10,000 people, but I'm so looking forward to it.
Yeah, I gotta say, I love hearing what folks want to do as their first thing once life gets back to normal. Sometimes it's big things, but sometimes it's just the small things, like giving a hug or having a drink with a friend.
I don't know. We all want that,
Yeah.
you know. And you know, we have so much to thank them for every single night.
Yep.
They have been there, and they have been calm, and they've never treated a question like a dumb question. And I know you're not done yet answering those questions, but seeing them there reminds me how much we owe them.
Absolutely.
That is a national for March the 11th.